Now to the measles outbreak that is causing concern across the country. An outbreak that is starting to show up with several cases in the Atlanta area. News Channel 6's Ashley Osborne talked to an infectious disease specialist today. She's joining us live now. Ashley?
Hey, Brad, he wants people here to know that even though the reported cases are in Georgia, currently there is no risk to our area. He explains some of the history of the disease and the concern among the medical community about it now.
Measles is a viral infection.
Pediatric infectious disease specialist Dr. James Wild breaks down the symptoms.
Fever, cough, red eyes, and a very distinctive rash.
According to the Georgia Department of Public Health, the 3 cases of measles in Atlanta came from one family, and none were vaccinated for the disease.
The people in the Augusta area don't really have a major worry here. Why? You have to be exposed to the infected person.
Measles is very contagious, and it used to be common in the U.S., but now it's not.
Millions of kids got it every year. Now it's extremely rare for a child to get it because the vaccines work so well.
And vaccines are a very emotionally charged topic. Many believe they do more harm than good and choose not to vaccinate their children. And for parents who are concerned, this is what Dr. Wild shares with them.
The concept that vaccines have been proven to cause autism, it's not true. This has been examined in dozens and dozens of studies. You have to be careful what you read on the internet. Millions of children per year died from these diseases. Now virtually nobody does. Why? Because we have vaccines.
A simple Google search brings up dozens of headlines in Georgia and nationally about the current measles outbreak.
I think the concern is that this is a growing problem.
He says while measles can kill, nowadays it doesn't often. The last measles-related death, he says, was an adult in 2015.
The odds are 1 in 1,000. So if we have 5,000 kids that come down with measles next year because their parents decide not to vaccinate them, you can pretty much predict that 5 of those kids are going to die. That's 5 kids that don't need to die.
In South Carolina, the Department of Health and Environmental Control reported at least 6 cases of measles back in November. Brad?